Okay, so last time we have studied the causes. Last time we have studied the different causes of the heart failure, right? So today we have studied the signs and symptoms. That once the patient suffer from the heart failure, what are the different signs and symptoms developed due to this heart failure? And we have started with the left heart. We have started with the left heart. That when there is due to different causes, the patient develops the failure of the left heart. What really happens that the left heart become big. Left heart become big, and blood cannot go out of the left heart, so blood will start accumulating here. When the blood will start accumulating over here, this left heart become big, and there is pressure in the left heart, and this pressure will go back into the atrium. Right? So slowly there is a back pressure development. When the back pressure reach to the pulmonary capillaries, from the pulmonary capillaries, this fluid will start coming out. And when the fluid from the pulmonary start accumulating out, our lungs become wet, boggy and heavy. Right? Our lungs become wet, boggy and heavy. So it becomes difficult for the person to breathe. And this difficulty in breathing is called dyspnea. This difficulty in breathing is called dyspnea. Now, when the patient is in the standing position, the fluid accumulate in the lower part of the lungs. But when the patient lie down on the bed, the fluid start accumulating in all parts of the lung equally, and the patient feel more difficulty in breathing. So the dyspnea become worse, and this worsening of the dyspnea is called orthopnea. Worsening of the dyspnea is called orthopnea. Now what really happens that when heart failure patient is sleeping at night, he feels difficulty in breathing, and he suddenly wake up to recover his breathing pattern, and he wake up and he stand up and then he start breathing. So this suddenly wake up this patient is called nocturnal dyspnea. On the top, all this fluid will start accumulating slowly, gradually this fluid will start accumulating in the alveoli of the lungs, and the patient will start developing cough. Along with the cough, the patient can also have the sputum, especially white color sputum. Then, if you listen the lungs of these patients, you cannot hear the lung sound very clearly. So you will feel abnormal lung sound. And these special kind of abnormal lung sounds in the heart failure patient, when you listen, these are called moist crackles. These are called moist crackles. Now, after all these symptoms, the fluid will start accumulating in the back, right? Especially in the pulmonary arteries, pulmonary trunk, and then this left heart failure will lead to the failure of the right heart. Left heart failure will lead to the failure of the right heart. Now the right heart will start developing big, enlarging. Right heart will start enlarging. Now the complication will develop on the systemic side. What complication will develop? That the blood from the superior vena cava and the jugular vein cannot draw. So the patient will have the jugular vein distension. In the same way, the blood from the inferior vena cava cannot draw into the heart, and this blood will start accumulating in the inferior vena cava and into the liver, and the liver will become enlarged. This enlargement of the liver is called hepatomegaly. This condition is called hepatomegaly. Then fluid will start accumulating out of the liver and will accumulate into the abdomen, and this condition is called ascites. On the top, the jugular vein, which is portal vein, which is draining the blood from the GID, this portal vein also becomes hypertensive and distension. So the blood from the GID cannot draw into the liver. So all the fluid and the nutrients which the patient eat, they cannot be absorbed by the blood into the portal vein, and these fluid and nutrients will go out of the body, and the patient will have diarrhea. On the top, the patient does not want to eat, so he will have loss of appetite. he will have the loss of appetite. On the top, the patient have the diarrhea, so the patient will feel loss of weight. The patient will also feel loss of weight and weakness. Loss of weight and weakness. And the patient will also develop nausea. He will also develop nausea. On the top, the veins, the jugular vein, please look at it. When the jugular vein is draining the blood also from the spleen. So due to this portal vein, not jugular vein, this portal vein hypertension, the spleen will also become big and enlarged. And this condition is called splenomegaly. This condition is called splenomegaly. On the top, the fluid will start accumulating all over the systemic circulation, and the patient will develop edema in the lower parts of the body. And this condition is called edema. This condition is called edema. On the top, the kidney will try to secrete more fluid out of the body. Kidney will try to eliminate the fluid out of the body, and the patient may develop polyuria. Patient may develop polyuria. Because the fluid is going out of the kidney, so sodium and potassium is also going out of the kidney. And this loss of sodium and potassium due to the kidney makes the depletion, decrease sodium into the blood. And this condition is called hyponatremia. Hyponatremia. On the top, if we don't treat the patient will go into the worst condition. And the the oxygen level in the brain, our nervous system, that will also drop. And the patient will feel lethargy, and the patient will feel unconsciousness and difficulty in thinking as well. Right? So patient will develop all these symptoms, but slowly and gradually. Slowly and gradually. And then for the diagnosis of these patients, we have said that first of all we can give the blood test to the patient. In the blood test, the most important indicator is BNP. The most important indicator is BNP. BNP stands for brain natriuretic peptide. It is special kind of protein which is released. A special kind of protein which is released from our atrium. So that is the most important indicator, one of the most important indicator of the heart failure. So we can write the blood test to check the BNP. On the top, because all these structures are being infected, especially the kidney and the GIT and the liver, right? So we can give the liver function test. We can check the liver function, whether the liver function are normal or not. We can also check the kidney function, that the kidney function is okay or not. Then we can also check the thyroid function. We can also check the thyroid function, because yesterday we have studied that one of the cause of the extrinsic cause of the heart failure is also thyrotoxicosis. One of the extrinsic cause was thyrotoxicosis, means high level of T3 and T4. So if we give the thyroid function test, we can check the T3 and T4 level in the blood. On the top, we can also check the electrolyte, because we said that sodium level in the blood is decreasing. So we can also check the electrolyte level in the blood by giving the blood test. Is that clear? Then we said that we can give the echocardiography. Echocardiography is also one of the most important tests for the patient of the heart failure. Because in the echocardiography, we can check what? We can check the size of the heart, size of the ventricle, size of the atrium. We can also check the size of the valves, mitral valve, or pulmonary valve, or tricuspid valve, or aortic valve, right? And we can also check the ejection fraction and stroke volume. And how much blood is going out of the heart, we can also check by the echocardiography. And size of the heart. So the echocardiography is also one of the most important tests for the diagnosis of heart failure. Then we can give the X-ray. The main and important function of the giving X-ray test is that we can find the chest to cardiac ratio. Chest to cardiac ratio. That in the normal person, the length or the ratio between heart to lungs is 2:1. 2:1. That in the normal patient, the length of the lungs is double than the length of a heart. But because in the heart failure patient, our heart is becoming big, our heart is enlarging. So in the heart failure patient, this ratio becomes 1:1. Is that clear? And at the top, we can also give the ECG test. ECG is electrocardiography. This ECG test we can give to check out the different causes, like for example, the patient may have the severe tachycardia or severe bradycardia. So we can give the ECG test to rule out whether the patient have a bradycardia or a tachycardia. And we can also check by the ECG. We can also check what yesterday we studied another hypertrophic obstructive cardiomyopathy, because whenever the left ventricle is hypertrophic, by the ECG, especially R wave, in the ECG R wave, we can also check the hypertrophy of the left ventricle. Is that clear? Do you have any question? Okay, if you don't have any question, we can finish our class.